Morning to all. Today we'll discuss a few points about the saliva. Everybody know that saliva is one of the important component of the mouth. Saliva is basically a fluid, okay, which coats the entire part of the mouth and the teeth and protects them from so many external factors. So saliva definition goes like this. Saliva is a complex fluid, helps to maintain the well-being of the oral cavity. That is mouth. Why it is called as a complex fluid? We'll see that. Now, saliva has got so many factors that we'll see later. Each factor has got its own functions. Like some factors are helpful in the digestive purpose, some factors are helpful in the lubricating properties, then some factors kill the microorganisms, and it goes on. So it has got so many factors, each one has got its own function. So it is called as a complex fluid. Now, where this saliva comes from? It comes from the salivary glands. So you know there are so many salivary glands are present outside the mouth and inside the mouth. Especially outside the mouth means we have got three very bigger salivary glands. They are called as a major salivary glands like parotid, submandibular and sublingual. These are all called as a major salivary glands because they are larger and their contribution, that is amount of saliva secreted, is more. So they are called as a major salivary glands. They are present outside the mouth. Through the duct system, they will pour the saliva into the mouth. Whereas there are so many small salivary glands present inside the mouth, in the tongue, cheek region, lip, palate and all. They are very smaller in size and their contribution to the amount of saliva is less. So they are called as a minor glands, minor salivary glands present inside the mouth. Okay. So likewise, so many salivary glands are there. They will secrete the saliva. Ultimately, all the saliva is poured into the oral cavity or the mouth. Now, saliva secreted by each gland will vary. Some glands secrete thicker saliva rich in proteins. They are called as a serous saliva. Some will secrete thick saliva, and they will be rich in carbohydrates, and they are called as a mucous saliva. So serous saliva will be thin, that is watery in nature and rich in proteins. Mucous are thick and they are rich in carbohydrates. Some of the salivary glands will secrete both the types. We call it as a mixed secretion. So likewise, the salivary secretion by the gland will varies. Ultimately, all the saliva will mix up in the mouth and we call it as a whole saliva. Now, this saliva, you know, it's very important thing. It's not only protects the mouth and it also helpful in digestive properties also. It also helpful in lubrication. That is, lubrication will helpful in the proper chewing, proper speech. This and all is possible only with the help of the wet mouth. So that wet mouth is given by the saliva. Okay, now when you talk about the composition of the saliva, this composition, already I told you, some salivary glands secrete serous saliva, some will secrete mucus, some will be mixed. So the composition of saliva secreted by each gland will vary, whereas ultimately all the secretions will come into the mouth only, that we call it as a whole saliva. So this whole saliva is a secretion, mixture of secretion from all the glands. So this saliva secreted by all the glands will be around 1200 ml per day. And this 1200 ml of saliva, we call it as a whole saliva, is per day secretion actually. Now, this saliva, major contribution to this 1200 ml is by submandibular gland. 60% of saliva secreted by all the glands is due to submandibular gland, whereas rest of the 40% is accounted by the parotid, followed by sublingual and minor saliva gland. So major contribution of saliva comes from the submandibular gland. Now, when you talk about this saliva, it's a fluid. So maximum component of the saliva is water. So water is important for hydrating the oral tissues, and this hydration is very important, plus coating the mouth is very important by the saliva. So by coating the mouth, it prevents the entry of the microorganisms, entry of other foreign substances, and that gives a lubricating property. So many things are there. So water already, you know, it's a very important component. So maximum percentage is water occupying the saliva, 99.5%. Only 0.5% is other solid substances. These solid substances can be categorized into organic and inorganic. Now, when you talk about the organic components of the saliva, it is calcium, phosphate, bicarbonate, fluoride, thiocyanate, sodium, potassium, chloride, lead, cadmium, and copper. Now, these organic substances, each one and has got some important properties. You know, calcium phosphate is very important for the formation of bone and teeth. So, this calcium phosphate present in the saliva will be added to the enamel whenever necessary occurs. That is, necessary means, decay or cavity due to microorganisms. So, whenever decay occurs on the teeth, the decay process involves the removal of calcium and phosphate from the tooth. This is called as a demineralization, removal of the calcium phosphate. How it occurs? Microorganism present in the mouth feed on the carbohydrate, whatever we take, produces acid. Fermentation of the carbohydrate food leading to acid production, that is lactic acid, that is produced by the bacteria, that causes removal of the minerals from the tooth, mainly from enamel, leading to decay of the cavity. So during that time, the calcium and phosphate present in the saliva may be added to that affected enamel and may repair the enamel. So that can happen. Only sufficient amount of calcium and phosphate are present in the saliva. Likewise, fluoride, another important component. Already you know fluoride and all present in the paste, it prevents the decay and all. Okay. So this fluoride also add to the strengthen the enamel, that by protect the tooth from decay. So these are the three important minerals present in the saliva. They offer protection against tooth decay. Then we have got bicarbonate. It's a buffer. It's CO3. So already I told you, acid will be produced by the bacteria in the mouth. So that acid will cause decay. So this bicarbonate present in the saliva will neutralize the acid and prevents the tooth decay. So calcium, phosphate, fluoride, bicarbonate and all ultimately protect the mouth from the tooth decay. So pH of the saliva ranges between 6.8 to 7.2. So this will be maintained by this buffer. They will neutralize the acid and maintain the optimal pH of the mouth. That will prevent the tooth decay. Then we have got thiocyanate. So it's a antibacterial substance. It can kill the microorganisms. Then we have got sodium, chloride, potassium. So this sodium, potassium, chloride and all, that is very important for the routine functioning of the body. So this sodium, potassium, chloride and all will be present in the blood and all. You know that whenever the body is lost fluid due to vomiting and diarrhea and all, the doctors will rehydrate our body with sodium and chloride. Okay, saline, normal saline they used to inject on us to maintain the body volume, that is fluid volume of the body. So these sodium, potassium, chloride and all also present in the saliva. They will be contributing there to the fluid volume actually. And then we have got lead, cadmium and copper and all. Actually, in the environment, so many pollutants are there. So you will inhale the substances. They will go to the lungs, to the blood, and they will be secreted in the saliva also. So this mostly these substances could be came from environmental substances. Sometimes they may be present in the body also. They may be required by the body in minute quantities only. Okay, for varying functions, not much important, these substances and all. Okay, they may be needed in very minimal quantities only. They will be present in the blood and they will be secreted in the saliva. So these substances can be analyzed in the saliva and we can find out to what type of environmental substances we are exposed to. So for that and all, these components may be helpful. But as far as body's function concerned, these are required in minute quantities only. Whereas calcium, phosphate, bicarbonate, fluoride, thiocyanate, sodium, potassium, chloride and all required in more quantities for our day-to-day functions. Then when you talk about the organic substances, we have got mucin, proline-rich proteins, amylase, lipase, peroxidase, lysozyme, lactoferrin, IgA, statin, stathin, gustin, and other substances. Each one has got one important thing. Mucin, if you take, it's a protein carbohydrate complex. We call it a glycoprotein, secreted by some of the salivary glands. When mucin is present, the saliva will be thick in nature. This mucin will coat the soft tissues of the mouth, that is inner aspect of the cheek, dorsal surface of the tongue, and lip, and palate and all. Thereby, it offers a lubrication, that is like oil. So whenever you chew the food, or whenever you swallow the food, whenever you speak, there will be movement of the lips, cheek, tongue, and all. So this by coating these areas, it will be helpful in the smooth movement without friction. That is the lubricating action. Plus, this mucin also will protect the entry of foreign substances and microorganisms into the underlying tissues. So they will protect our body also. Then we have got you can see that proline-rich protein, and down if you come have written statherin. So these are all proteins, proline-rich proteins and statherin. All they are helpful to maintain this calcium level in the saliva. So when the calcium level is maintained, that will be utilized by the enamel for remineralization and all. Okay, so they are helpful in the maintaining the calcium levels. Then we have got amylase and lipase, digestive enzymes. Amylase will digest the carbohydrate food whatever we take. Lipase will digest whatever fat substances we take. They are all present in the stomach and pancreas also, but digestion starts in the mouth itself. Okay, so in this lipase is very important. This is the only source of fat digesting enzyme in the newborn babies, because lipase usually secreted by the pancreas. During birth, the pancreas will be not much developed, so pancreatic lipase will not be there. So this oral lipase only utilized by the babies for digestion of fats. That is why fat-rich diet and all will be not much will be given for the babies. So it will be difficult to digest because only source is oral lipase. It's otherwise called as lingual lipase. Why means this is secreted by the von Ebner minor salivary gland present in the tongue near the circumvallate papilla. So we call it as a lingual lipase. So von Ebner gland will secrete serous saliva, plus they will secrete lipase also. So in that sense, that gland is very, very important. Then we have got peroxidase, lysozyme, lactoferrin, IgA, and statins. Peroxidase, lysozyme, lactoferrin, IgA, statins. These are all antimicrobial substances. Statin will act against the fungal organisms, whereas other substances will act against the bacteria. So lysozyme and all will kill the bacteria by damaging its cell wall. Lactoferrin will kill the bacteria by interfering with its ion absorption. Ion is needed for the bacteria for its growth. So when this lactoferrin prevent the entry of ion into the bacterial cell, thereby bacteria will not get ion and will die. IgA, Ig means immunoglobulin, antibody. So IgA is a type of antibody produced by plasma cells. Plasma cell is again a derivative of B lymphocyte, white blood cell. Okay, so that white blood cell, B lymphocyte, transform into plasma cell and secrete so many antibodies. You heard about IgA, IgG, IgM, IgE, IgD and all. In that, IgA is present in the saliva. So that will protect our mouth from microorganisms like bacteria. They'll kill the bacteria and they'll protect our mouth from infections. So peroxidase again kill the bacteria. So these are all antimicrobial substances. Okay, then we have got small amount of sugars will be present in the saliva that is secreted from the blood only. Okay, then we have got other substances like ammonia, urea. They also will fight against the bacterial organisms. Okay, then we have got epidermal growth factor helpful in the formation of epithelium, and vascular endothelial growth factor helpful in the formation of blood vessels. So these factors are helpful during healing of some injuries in the mouth. So like this, so many substances are present in the saliva. Each one has got its own functions. Okay, so this is the composition of saliva. So main composition, again, if you go back to the previous slide, we have got 99.5% water, only 0.5% is solids. That is, solids includes organic and inorganic compounds. That only we have seen. Then we move on to the functions of saliva. The same thing, whatever we have seen in the composition of saliva will come again here. Okay, so main function of saliva is flushing action. By the flow of saliva, it will clean the mouth, protect the mouth from decay and all. If no saliva, no cleaning action. Food will stagnate in the mouth, attract the bacteria, leading to gum problem and decay and all can happen. Then bad breath will come, halitosis can come. So that is prevented by this cleaning action of the saliva. Salivary flow is very important. Then lubrication and permeability barrier. Already we have told mucin will coat the tissues of the saliva and helpful in the lubrication process and permeability barrier. This coating of mucin will prevent the entry of bacteria into the tissues, other foreign substances into the tissues, thereby protect the tissues from harmful effect of these substances. Then antimicrobial action, this you have seen. You can see from this slide, peroxidase, lysozyme, lactoferrin, IgA statins. These are all antimicrobial substances. They'll kill the bacteria and fungus. In addition, we have got thiocyanate and ammonia and urea also. This ammonia and urea also has got buffering properties also. They can also neutralize the acids also. Then buffering action. This already we have seen. Bicarbonate present in the saliva, urea, ammonia, all these can neutralize the acid produced by the bacteria. So acid environment leads to decay. Neutral environment will not lead to decay. So these bicarbonates naturally present in the saliva will neutralize the acid produced by the bacteria. So what happens, the pH of the saliva will be maintained between 6.8 to 7.8. Mainly the pH of the mouth depends on saliva only, salivary flow only. So neutral pH will be helpful in the prevention of infections in the mouth. Okay. Digestion, already we have seen two enzymes, amylase, lipase, helpful in the digestion of carbohydrate and fat respectively. So digestion starts in the mouth itself, very, very important. If you chew the food properly, the food will be present in the mouth for a longer time so that these enzymes can act and start the digestion. So it will be easy for the esophagus, stomach and all to digest very easily. If you swallow the food as such, the particles, food particles will be larger, no digestion in the mouth. So it will be difficult for the stomach to digest, leading to indigestion. So you have to chew the food very properly. Then only it will be broken down into smaller pieces and digestion starts in the mouth. So during chewing, the food will be exposed to the oral enzymes. So digestion will start in the mouth. If you swallow, this cannot happen, leading to indigestion. Mineralization. So calcium, phosphate, fluoride and all present in the saliva. So they will be helpful in the repairing of the affected enamel. Remineralization. So removal of the mineral from the tooth by decay is demineralization. Deposition leads to remineralization. So that is the important function. Taste. Food particles has to dissolve in the saliva. Saliva will take the food particles to the taste bud present in the papillae of the tongue. Then only we can appreciate the taste sensation. If there is no saliva, food particles will not dissolve. They will not be carried to the taste buds. So it's very difficult to appreciate the taste sensation. So dissolving of the food in the saliva is very, very important. It will be taken to the taste bud. We'll appreciate the taste sensation. Then tissue repair. So already we have seen the previous slide. We can see from that others that epidermal growth factor, vascular endothelial growth factor. Epidermal growth factor helpful in the formation of epithelium. Vascular endothelial growth factor helpful in the formation of blood vessels. So in the mouth, any injury occurs to the soft tissues. For example, during chewing, you may mistakenly bite the tongue, lip, cheek and all. So that time what will happen? Bleeding will occur. That tissue will be injured. So that and all will be repaired by these factors, by formation of epithelium and new blood vessels. So wound healing will be good in the mouth always because of this saliva. So these are the important functions of the saliva. So if you go through the composition, each and every component of the saliva has got one function. So each and everything component of the saliva is very, very important. Then, so we have seen the composition function. So next, the saliva can be used as a source to find out the disorders present in the patient also. You know that patient is suffering from any fever and all. They will go for a blood test. So from the blood test, they will find out what type of fever it is, malaria, typhoid. So urine test, motion test and all will be done. Likewise, saliva can be taken, collected and can be used to test the for the particular person. So this can be done utilizing the saliva. Saliva collection is very easy, economical, and it will not cause any pain to the patient also. Because if you give a sterile, clean container to the patient will spit the saliva very easily. That you can utilize for finding out the disorder the patient is suffering from. So in this way, saliva can be used as a medium to find out the disorder for the patient. Viral infections and then sugar present in the saliva can be estimated. Likewise, the patient will be suffering from some disorder like cancer. What type of cancer it is? We can find out from the analyzing the saliva, because some cancers will secrete some substances. That is, cancer cell will produce some substances, and sometimes our body will produce. Likewise, in some cancer, the body will produce some substances against the cancer cell. In some cancer, the cancer cell itself will produce some certain substances. They are called as a biomarkers. This also can be analyzed in the saliva. So by analyzing these biomarkers, we can find out what type of cancer it is, harmful or harmless, and what type of treatment is needed, whether the cancer is responding to treatment. That and all can be analyzed by seeing these biomarkers in the saliva. So the saliva also can be utilized as a diagnostic fluid, similar to blood, urine, and motion. Then this is one of the important conditions, xerostomia. Sometimes people have dry mouth because of lack of secretion of saliva. It can be due to some disorder of the salivary glands, or it may be due to some drugs, like drugs taken for allergy and all can cause this dry mouth. Plus, it can be due to some infections of the salivary gland. And so dry mouth can be due to so many reasons. Even diabetes can cause dry mouth. So the patient will come with a complaint of dryness in the mouth, not able to chew or speak properly, and a bad breath. Like this, they will come, and burning sensation in the mouth and all. So we have to look into the mouth and analyze what type of problem. If you find out it is xerostomia, you have to find out the cause. The xerostomia is due to what? Then you have to treat the patient. Because saliva is very important. Already we have seen it has got so many functions like lubrication, killing the microorganisms, speech, chewing the food, taste sensation, wound healing. So many things are there. So saliva is very important. So we have to treat why it is occurring. Okay. So when the patient is suffering from dry mouth, you can see that tongue will be dry, and we can see the cracks in the tongue. Then dry mouth leads to so many infections in the mouth. One such is a fungal infection. This is caused by candida, one fungus. Okay, it appears like a white patch in the palate or tongue in the buccal mucosa. So it's common in dry mouth. Usually diabetes will have a dry mouth. They are prone for this fungal infection and all. Then due to dry mouth, flushing action of saliva is not there. So what happens? Food will stagnate. Where the food will stagnate? The food usually will stagnate in uncleaned mouth and near the gums, the cervical part of the tooth. So this will attract the microorganism, leading to cervical decay or the tooth caries. So this is also common in the people suffering from the dry mouth. So like this, if there is no saliva, it can lead to so many problems like this decay, gum problem, bad breath, fungal infections, like that it can happen. So we have to treat, we have to find out whether the patient is having dry mouth, and we have to treat why the dry mouth is coming. That we have to find out the cause, we have to treat that. That's very, very important. So as such, saliva is very important. I think this presentation will be useful to you. So maintenance of proper salivary flow in the mouth is very important. That will lead to the healthy mouth. Thank you all.